Chronic obstructive pulmonary disease, otherwise known as COPD, has two different components. The first one is emphysema, and the second one is chronic bronchitis. I'm going to explain to you what each of these disease processes does, what the symptoms are, so that you kind of have a better idea about what COPD actually is. So we'll start off with the chronic bronchitis. It's over here in the green. Chronic bronchitis is diagnosed after you've had the same symptoms at least 3 months in 2 consecutive years. So it's kind of a mouthful. But basically, it just means you have 3 months out of the year that you get bronchitis, and you have those 3 months 2 consecutive years. So this is something that a lot of times the doctor will pick up on. But if you're trying to keep track, that is the way you do it. And it's characterized by, well, it's in the name, bronchitis. So it's the bronchial tubes. I've gone ahead. I'm not an artist at all. So just enjoy this for what it's worth. It's not a medical drawing per se, but it is going to give you an idea. So this is your trachea. It goes down into the lungs, branches off. All of the green there, those are bronchial tubes. So bronchitis affects the bronchial tubes. So you can see they branch off. It's just like a tree in there. So it has like the big ones, and then they break off into little ones, smaller and smaller, throughout the lungs. So chronic bronchitis, it affects the bronchial tubes. What it does is it's when you get a lot of irritation in your lungs. So your lungs, bronchial tubes, they are inflamed. When there is a lot of inflammation in the bronchial tubes, they start to slough off mucus. So in there, you've got inflammation. So everything is swollen. Then you've got the mucus that's going to get started producing. So that stuff starts in. Well, then what will happen, you're having all of that inflammation and all of that mucus. That's when you're going to get sick. So you're already sick with the bronchitis, but what will happen is you'll go out, you'll be around a lot of people, maybe, you're going to school or to work with bronchitis, and then you're going to pick up other little bugs that could cause pneumonia or various things, but it'll get caught in all of that mucus that you have. So it's really important when you have COPD to keep the mucus under control as best as you can, because that's going to really help you as far as illnesses go. Now, the other part of COPD is emphysema. Now, this is why COPD is so bad, because the bronchitis affects the bronchial tubes, right? Well, the emphysema affects the air sacs at the end of all of those bronchial tubes. So COPD as a whole will effectively mess up the lungs all the way around. And so emphysema, like I said, it affects, they're called alveoli, and they look like little grapes clustered together, but they're at the end of all of the bronchial tubes. And these alveoli, I'm going to try to show you here. When a person breathes in, they expand. That's why you see your lungs expand when you breathe in. So they're going to expand, and when they're open, that's when they exchange gases with your bloodstream. So once these open, they get really close to the edges of your lungs, and then it's going to put oxygen into your blood. And with these alveoli, when you exhale, you're going to be blowing out CO2. So these alveoli, they are responsible for giving your body the oxygen that it needs and getting rid of the CO2 that you don't need. And not only do you not need it, but it can be toxic if it sits in your blood, and it'll just accumulate. So that's when you hear about people who are COPD retainers. These are people that will actually keep the CO2 in their blood. So as you can see, that's why COPD is so bad, because it just affects everything, really. But emphysema is very, very gradual. Most of the time, when you are in the very early stages of emphysema, you don't even know that you have a problem. And that's because it affects the air sacs, but you have so many air sacs that a lot of times the other ones they'll start doing what they all should be doing. So you don't really notice a difference until you're more advanced into the process. So these little alveoli, what the emphysema will do, it will actually break down the walls. So if you had like two alveoli right here, over time you may just have one that's a little bit bigger and it doesn't go back all the way down. So where you have the inhale open, exhale close, it's more of an inhale open, exhale close. It's not going to close all the way. This is how you retain air, extra air in your lungs. That is from the emphysema part of COPD. So I know it probably sounds kind of complicated, but that is COPD in a nutshell. Now, this is also the reason why people who have COPD experience different symptoms, because some people may have worsening bronchitis than the others, while somebody else may have worsening emphysema than the others. So that's why you get kind of a plethora of signs and symptoms when you have COPD, because you've got two different things going on there. Now, when they're combined together, obviously, like I said, it's the chronic obstructive pulmonary disease. So you've got it all linked in there. That's also why when you're taking different medicines, a lot of times you'll have to take different types, and that's just because you're treating different things. But it's important when you have this. There are lots of things that you can do to kind of decrease your illnesses. But it's very important, especially with it being like cold and flu season. Just make sure you're either wearing a mask or you are washing your hands. Making sure that if you're around anyone who's coughing, turn the other way. You want to lessen the exposure to pretty much anything, because that's what really hurts you when you have COPD is you're just moving along, everything's okay, but then you get sick. And every time you get sick, it just makes it harder and harder on you. So it's just very important to keep yourself well. Like I said, wear masks, wash your hands, make sure that you are getting rid of that excess mucus if you have it, seeing your doctor if you notice a change in your mucus so that they can go ahead and start treating you if you're getting the beginnings of some sort of an illness. So there you have it. That's COPD. Hopefully you can understand my drawings and you understand it a little bit better now.